Now we're going to enter in the patient's insurance. On the insurance tab here, you can see up at the top that the patient is John Adams. It's no longer Carrie Heffernan if you were watching the other training videos. And you can see for John Adams, he already has insurance entered. The primary coverage here is BCBS, which down here you can see is Blue Cross Blue Shield. Now what I want to do is I want to be able to add additional insurance. Maybe I want to add secondary insurance or maybe another primary insurance. So what we're going to do is start from the top here, come all the way down and around, and then when we're finished or towards the end, we'll go over checking eligibility. First of all, if I start selecting information down here, I'm going to overwrite my Blue Cross Blue Shield. You see how it's selected, highlighted in blue, and the information's down here, Blue Cross, also the subscriber ID. You don't want to start typing in over this, because if you do, you're going to overwrite this. Instead, you want to come over here and click Clear, and you can see down below it clears everything, well, except the subscriber ID, which could be the patient's social security number. In any case, it clears it down here so we can start entering in our next insurance coverage. First of all is the effective date. Now today's date is July 31st, and you can see right here it's got July 21st. Now the reason why is that Advanced MD's default is always going to be 10 days before today's date. And the reason why is because if you enter in the patient's insurance today and they're scheduled for a date of service today, the insurance or the clearinghouse Relay Health is going to reject it because the effective date has to be before the date of service. So better yet, if you know the date of service, let's say it was January 1st, 2008, go ahead and click on the drop down arrow, select January, and then click on the first here to select it, and then click off in a blank area, and there's January 1st, 2008. Or what you can do is you can come in here and delete it and type all numbers in there, 01, 01, 2008, and then hit the tab key and it automatically updates it for you. You don't have to type in the slashes. Once you tab, it takes you over to the next box, and this box is the inactivation date. So remember, we're entering in a new insurance carrier, let's say Cigna, and we don't want to type in the inactivation date because, well, it's not inactivated yet. Then go ahead and hit the tab key. It comes down to the carrier field, and this is where we can go ahead and select the insurance carrier, which is going to be Cigna. So what I want to do is I want to type in the first letter of C for Cigna and hit the tab key, and it'll do a system search to find all the insurance carriers that begin with the letter C here, and Cigna is one of them. You see how it's highlighted? I can go ahead and double click on Cigna and it adds Cigna here. Next is the coverage. Is it secondary, primary, tertiary, or workers, auto? Okay, I'm going to go ahead and say it's primary, and you can see I already have a primary insurance up here, but what I want to do is this one I want to inactivate. Let's say the patient's primary insurance just canceled today and they gave me a new insurance card, which is Cigna. Now, maybe they didn't. Maybe this is their secondary. But for this example, I'm going to say it's primary, okay? And then I'm going to go ahead and tab and go to the group name. Now on the insurance card, if you have the group name, go ahead and type it in. Not all insurance cards have group names, so you may want to tab past that. But Blue Cross Blue Shield, 99% of the time, if they don't have a group name on the card, you may want to type in just anything, just something here. And the reason why is because Relay Health, when you submit your claim through the clearinghouse, if you don't have something in this field for Blue Cross Blue Shield, it's going to kick it out. So this is Blue Cross Blue Shield only, okay? If you don't have a group name, make one up, okay? In any case, I'm going to delete that, and let's say on the insurance card for Cigna, they didn't give us a group name. So I'm going to hit the tab key and come down to group and type in the group number if there is one available on the insurance card, and I'll just make one up here and pretend that we have one. Then hit the tab key and taking us over to the subscriber, the policyholder, or the guarantor. And what we want to do is find out, is it really John Adams? So if you look on the insurance card and let's say it's not the patient, and you can see up here the patient is John Adams, what if it's his mother? If you need to make changes of the policyholder or the subscriber here, go ahead and click on the button here, subscriber. Now up at the top we're looking at two buttons. We're looking at the patient or the family member. Which one is the policyholder, the guarantor, or the subscriber? If it's the patient, just click on the patient button and it automatically populates in the patient's information. So if it is the patient and the information is already here, just close out. Otherwise, click subscriber again, and if it's a family member, once you click family member, it clears everything out except for the address because it assumes that the family member lives at the same address. So if this is the mother of John Adams, like Mrs. Adams, then just come in here and you want to do a search. You want to go ahead and type in the last name Adams and hit the tab key. Because if there's anybody else listed here, you want to select them, especially if it's Susie, if she's already in the system, because you don't want to create duplicate subscribers. You see what I'm saying? So Susie isn't listed here. Go ahead and click cancel. And let's come back in here and click twice and type in the full name, last name, comma, no spaces, first name, Susie, and then hit the tab key. And then of course, make all the changes that you need to, female. If Susie's at the same address, if not, update it. Be sure to put in the zip code, the home number, And probably most importantly is to make sure you got the date of birth for Susie. Click on the drop down arrow. Maybe she was born back in, I don't know, 1941. Click on that. You have these arrows here. If you click on the inner arrow, it'll move you out month by month. You see how it goes from May back to April, back to March. And then if you do the double arrows, it takes you back by year here. See, there's 1940. If I click back, it goes to 1939. So simply select the date and then click off in a blank area, or just double click on the date and it'll automatically update for you. Social Security number, hit the tab key, come down in here and then type it in, whatever the social is. And I'm making one up as we go. Hit the tab key. And the reason why I emphasize hitting the tab key is to make sure that the data that you have here is acceptable. Because if I click off out of the field and I click in other fields here, that may be okay, but not after I just typed in something. After you're done typing in, hit the tab key so it can acknowledge and verify that the data you entered in was correct. Alright? Type in an email address if you have it, their employer status if they're full, part-time. Then when you're finished, be sure to save your work. When you save it, there's Susie here. She is now the policyholder, the guarantor, the subscriber. And we're going to continue down here. Now the subscriber ID is Susie's, right? Because we entered that in when we clicked on the subscriber right here. It's a social security number. Well, it's defaulted. If it's not the social here, close out. If the subscriber ID isn't Susie's social, maybe it's for Cigna, maybe it's some other number here, go ahead and type it in. Now when you type in subscriber IDs, make sure that you have any symbols whatsoever. Don't put in symbols, don't put in dashes, don't even put in spaces. So if I type this number again, and I'm typing it in, and there's a space and then a few other numbers, forget it. Get rid of the spaces. Go ahead, come in here, hit this backspace and make sure it's all together, okay? And then also with Medicare, be sure to add the suffix here, the letter A, okay? So you want to look on the insurance card, make sure there's no symbols in the subscriber ID, and that everything is together. There's no spaces, and then when you're finished, go ahead and hit the tab key and come down here to the relationship. The relationship is the relationship of the patient, John Adams, to Susie. What's the relationship? Is John the son, the nephew? Well, click on the drop down arrow and he's going to be the child. So what's the relationship of John, he's the child, to Susie? Of course, if John Adams here was the subscriber, then we would choose self, right? But he's the child of Susie, of the policyholder, so we'll select child. Hit the tab key. Next is copay. Is it going by dollar amount or by percentage? Let's say Cigna says they have at least a $20 copay, so I'll type in 20, hit tab. You see how it automatically adds the .00 or the cents after I hit tab? So there's some things that you'll know after you hit tab that you won't have to type in. So I don't have to come back in here and type in 20.00. All I have to do is delete that, type in 15, hit the tab key, it automatically adds it for me. What's the status of the patient here? Are they full-time or part-time? If not, just leave it blank. And then the MSP code is the Medicare Secondary Payer Code. All that means is that if this insurance carrier is Medicare and they're secondary, Medicare wants to know who the primary is. So if I go ahead and I delete Cigna and I type in the letter M for Medicare, okay, and I hit the tab key and let's say it's Medicare of Illinois and I double click on Medicare. So let's say Medicare is the carrier. Let's say that they're not primary but they're secondary. See what I'm doing? MSP. The S stands for secondary. So anytime that Medicare is the secondary, Medicare wants to know who the primary is. Let's click on the drop down arrow and see if Blue Cross is in here. It's not, so it would be other. Again, anytime that Medicare is the secondary insurance carrier, they want to know, in order to process your claim, who the primary is. It's either going to be employed, black lung, PHS. If it's anybody else, then always choose other. And then when you're finished, be sure to save your work. Once I save it, it does a couple of things. First of all, it adds it up here, and it puts an insurance order with a sequence number of number 2. Now these insurance orders, 1, 2, it doesn't mean that number 1 is primary or number 2 is secondary. It just means it was the time that I entered in Blue Cross, it's the first insurance. The time I entered in the secondary is the second insurance. Doesn't mean number 2 is secondary necessarily, so keep that in mind. What I wanted to show you though is if I need to make changes to Medicare or Blue Cross, just go ahead and select Blue Cross, it populates down below, make your changes, hit the backspace and type in a 2, whatever you need to do, and then be sure to save your work. So if I come back here to Medicare and go, whoops, I didn't mean Medicare, come in here, delete it, type in the letter C, hit the tab key, double click on Cigna so it pulls Cigna in here, and then be sure to change your MSP code back to blank, and then go ahead and click Save, and it'll update the information up above here. Finishing it off here, down below you have the insurance address. You also have any phone numbers, so if you need to call the insurance, they should be listed here. If they're not listed, it just means that somebody, the biller or the coder or whoever's updating the insurance, hasn't typed in the phone number yet. In any case, you can come down in here and type in any notes. This is the notes field, so whatever notes you want to make about this insurance carrier for Cigna and Blue Cross, type it in down here. The drop down arrow here is for insurance cards. So if anybody scanned in the Cigna or the Blue Cross Blue Shield insurance card, you can select it from a drop down list here, and the insurance card will appear here. You can look at the insurance card to verify and validate that the subscriber ID you see here matches what you have here for Cigna or Blue Cross if you come up here and select Blue Cross. The Relay Health website, there's a link there that you can go to. Up here, of course, you have your save, you have your clear. Be sure to always click clear before you enter in new insurance so you don't overwrite your Blue Cross. You see by default it's selected here. The copy button is really cool because if you work at a pediatrician's office and you got 6 or 7 family members, let's say we entered in John. He has a few siblings like Sherry, Sally. How many times are you going to have to enter in this insurance over and over and over again for all 6 siblings? Well, instead, once you enter it in once for one of the siblings, like for John, all you have to do is when you come back and let's say now we're entering in Billy Adams, all you have to do is click on the copy button, and what the copy button does, it'll list all the patients who are related. So John's listed here. All I have to do is go ahead and click OK, and it'll copy over John's insurance information. And once it copies over, it automatically copies it here.